Obesity, smoking, alcohol abuse, and substance abuse. There are so many other physical causes which we're not going to discuss today. What's up, beautiful people? Welcome to another exciting episode of Pillow Talk with Dr. O. You already know. And today we're discussing something very interesting. Actually, today is for the men, but of course the women can also benefit from this because you know it concerns you as well. So you must have already seen it from the thumbnail. We're discussing erectile dysfunction. So what is erectile dysfunction? What causes it? And how can we treat this condition? That's everything we're going to be discussing in today's episode. So let's jump right into it. So what is erectile dysfunction? Like, do you know that a lot of men misuse this term erectile dysfunction, right? They think they have erectile dysfunction, but they don't, okay? So today we're going to be breaking it down. What exactly is erectile dysfunction? This is totally different from premature ejaculation. I've extensively discussed premature ejaculation in other videos in this Pillow Talk playlist. So please go to my YouTube channel and look for the Pillow Talk playlist and watch everything you need to know about premature ejaculation. Premature ejaculation is when a man orgasms before he desires to, or when he orgasms before the regular time. So erectile dysfunction is different. In the case of erectile dysfunction, the man is not able to achieve an erection. That means he can't even get an erection, or in some cases he can achieve it but he can't even keep an erection, so his erection doesn't last long enough for him to be able to have intercourse with his partner to a satisfactory level. So in the case of someone that has premature ejaculation, they can achieve an erection, right? But in their own case, they don't have a problem with maintaining an erection or achieving an erection. What they have a problem with is orgasm. So they orgasm faster than they should. So you see that they ejaculate quickly and their partner is like, oh, what's their problem? And then they start giving them names like 1 minute man. So that one doesn't have a problem with his erection. What he has a problem with is controlling when he orgasms. But in someone that has erectile dysfunction, they can't even achieve an erection, or even if they manage to, they can't keep it. And this can be really frustrating for a lot of men. You see a lot of men complaining, and you know, it can be frustrating because you know men love the other room. So basically, why would a man have erectile dysfunction? What are the kind of things that could predispose a man to having erectile dysfunction? So first of all, just like in premature ejaculation, we have the physical causes and the psychological causes. So for physical causes of erectile dysfunction, we're looking at things like medical conditions like diabetes, one of the major factors that causes erectile dysfunction, hypertension, that is high blood pressure, high cholesterol levels, a condition called atherosclerosis, so where your arteries, that is the blood vessels that supply blood to different parts of the body, when they are clogged up with fatty deposits, right, in the wall of the arteries, then it starts to make the diameter, right, of the artery, it begins to make it narrower, and blood is not able to pump through. Okay, so this can happen in any type of blood vessels, the arteries, the veins, or whatever, and this becomes a problem in men. Other things that could cause erectile dysfunction include obesity, smoking, alcohol abuse, and substance abuse. There are so many other physical causes which we're not going to discuss today, but those are the few and more common causes that affect men when it comes to physical causes. Now let's move to the psychological causes. What are the psychological causes that could possibly cause a man to have erectile dysfunction? So one of them is stress. Stress of life, physical stress, you're not getting enough sleep, you're not getting enough rest. Sometimes it can be emotional stress, relationship problems, you're having issues with your partner and things like that. Sometimes it's that you don't even find your partner sexually attractive, so you're not even able to achieve an erection. Some men find that with certain partners they cannot achieve an erection, meanwhile with other people they can. So sometimes it might be your partner that is a problem, you not being sexually attracted to your partner, or you having relationship problems with your partner, or stress. Depression and anxiety are also psychological factors that can cause erectile dysfunction. So now that we know the causes of erectile dysfunction and what it is, then how do we manage this problem? When you have erectile dysfunction, what do you do about it? Okay, so first of all, we always say the first step to solving a problem is knowing that you have a problem and knowing the cause of the problem. So how we treat or how we manage erectile dysfunction will depend on the cause. If it's a physical cause, then once we treat the physical cause, then the problem of erectile dysfunction should be solved. So for example, if you have diabetes, then you need to see your doctor to get medications to control your sugar. Of course, when diabetes is advanced, if it has destroyed the blood vessels and all that, then erectile dysfunction issue, it may not be totally reversible. You may need certain medications to help you achieve an erection. Say with high blood pressure, when you control your blood pressure, erectile function should go back to normal. However, if it has gone to an advanced stage in which the destruction or the damage caused by the high blood pressure is not reversible or irreversible, then we have medications that we can recommend that can help you achieve an erection, right? Same thing with cholesterol, all of that causes smoking, alcohol. So when men have erectile dysfunction and it's due to physical causes, one of the things we do is give them medications that can help them to achieve erections. One very popular medication is brand name Viagra. Everybody knows Viagra. So a lot of older men take this when they're not able to achieve an erection, because you know older people tend to have more of these physical conditions like diabetes, high blood pressure, and high cholesterol and all that. So when they take this medication, it helps them to achieve an erection. I will normally prescribe this medication and ask them to take it a few minutes before sex, so about 30 minutes before sexual intercourse, to help them achieve an erection. Achieve and maintain an erection, very important, because it's not just about getting an erection, but you have to be able to maintain it long enough to satisfy your partner. Another thing that we can use to manage erectile dysfunction in certain men that have physical causes is something that we call a penile pump. So it's like a vacuum device. It's either manually powered or battery operated, and you attach it to your penis. Okay, it now creates a vacuum that will suck blood into your organ, that will make it erect. And once it's erect, you now apply a tension ring at the base to keep the blood there, and then you have intercourse with your partner. Normally, an erection achieved with that stays long enough for you to be able to satisfy your partner, and then after intercourse, you take off the tension ring. Okay, so that's another option. And then we have penile implants as well. That's for physical causes. Now let's talk about psychological causes. Again, knowing what the cause is helps solve the problem. So for example, if the reason you're not having an erection is because you are not sexually attracted to your partner, then you need to discuss with your partner. Find out first of all, why am I not? Did she change? Was it her weight? Did she stop wearing attractive things? Or is it just my mind? Or, you know, you need to be open with your partner and tell her, okay, I need you to do this, I need you to do that. Okay, maybe we need to work together so we can lose some weight. You know, maybe we need to work on our relationship if we're having relationship problems. And if it's stressed, then take some time off to relax, start getting more sleep, take a vacation or something. If it's depression or anxiety, then you might need to see a psychologist if you're not able to handle it on your own. But trust me, once the psychological issues are dealt with, then erectile function will return to normal. But always remember, like I said when I was talking about premature ejaculation, having a supportive partner goes a long way in solving this problem. Without a supportive partner, it's going to be really difficult to solve this problem of erectile dysfunction. So make sure you have a supportive partner. Make sure you are open with your partner so that both of you can deal with this and work through this together. If you enjoyed this video so far, don't forget to click the like button, subscribe, and share with anyone you think might need to see this. Like I always say, your sexual health is equally as important as your general health and well-being. See you next week.